Welcome to the Next Generation Technological Solutions in Healthcare. Our facilitator is Dr. Matthew Leotine. He's Vice President at BLR Research, where he's a highly sought-after management consultant. Now, he's also a professor at the University of Illinois at Chicago. Welcome, Matt.
Hi, Gene.
So we're on theme number 5 now, using data science and analytics to improve the healthcare financial ecosystem. What are we going to talk about today?
Well, the focus of this theme was see how we can leverage some of these methods to try to solve some of the issues in the healthcare financial ecosystem. So touched upon things like where does data come from? What are the prime sources of data that you need in healthcare related monetary processes? What are some of the most immediate and recognizable problems attributed to insufficient or inadequate data? And then what kind of benefits, what kinds of things can be achieved using these types of data science and analytics approaches?
And tell us about the panel that had this conversation.
Well, like always, we have a population of panelists who represent diverse interests in the healthcare space. We have technologists, we have managers, people who deal with the finance side, and of course, we have medical practitioners.
Let's get into your executive summary here, Matt. How might we use data science and analytics to improve the healthcare financial ecosystem? Tell us about your findings.
Yeah, well, in addressing this question, we touched upon several areas. One is the fact that, and today and where things are going, data is going to be originating from many, many diverse places, both internally and externally to the healthcare ecosystem. And so that poses many challenges with preparing this data and also to keep the data updated because industry changes, the environment changes, patients change as well. But data analytics and data science has one strong ability, and that is to identify patterns. So we talked about how patterns can be used to associate not only patient treatment and outcomes, but also patient characteristics with the costs and outcomes of the treatments as well. And then we touched upon what kinds of technologies could be used. And the takeaway from that particular finding was that it all centers around coordinating and sharing data access.
So, Matt, in key point number 1, you sort of break down where all the different sources of data is coming from.
Yes, we touched upon the fact that data is coming not only from traditional sources, but also there are new origins of data, things like wearable devices, software applications, sensors that track patient data in real time that feed not only medical systems, but also they could have the potential to feed monetary systems as well. And this could help ease the financial transactions and monetizing that is involved. And as data is obtained from these devices and systems, you can then log these events and trigger financial transactions. And we're talking about not only internal sources of data, the traditional ones like electronic health records and clinical decision support systems and those kinds of systems, but also looking at maybe external sources as well, like government sources, government agencies, laboratories, pharmacies, HMOs, insurance companies, etc. Of course, the thing about this is that when you have all this, you have data arriving in multiple formats, at multiple locations, in numerous legacy formats and numerous legacy applications, as well as new technology, new systems, new applications as well. So it's going to come from many, many different places.
So in key point 2, you sort of talk about this question, I guess. How do you keep up with all the different amounts of data and sources of data?
Well, I think the fact that we even talked about it makes it now a requirement that any new type of technology must have to deal with this challenge, and that is to make sure that not only do you curate the data, try to come up with common formats, but also you need to have processes and systems that can actually keep up with the changes that go on in the environment in the healthcare space. So things like there's always new treatments coming out, there's new drugs, there's new personalized care models, there's changes in demographics, changes in patient profiles, and even companies, payer organizations, insurance companies, they're always merging and acquiring each other. And so that also can have an impact on maintaining and keeping data and sharing the data.
Now, Matt, in key point number 3, you talk about using predictive analytics to improve not just care, but also cost. How do we get there?
Well, here we're talking about using predictive analytics modeling to identify patterns to ultimately that could be used to yield optimal outcomes by associating patient characteristics with the cost that was involved for a treatment and also what kinds of outcomes were obtained. So that way you could find the best fit and the most cost effective outcomes for a patient. It also involves using analytics to identify the ability for a patient to pay and what kind of interventions they would need in order to make sure that they do fulfill their payment obligations. So that would mean, like, for example, do they need reminder calls? Do they need any kind of modifications? So the idea here is to use these models to distinguish between those who can pay in full, maybe those who need installments, or those who might need subsidization of some kind.
And then tell us about these top three experts that helped you with this conversation.
Yeah, these three individuals provided some rich, robust content to this discussion. We really thank them for their skills and expertise. It really created a lot of value to what we have here.
And what's coming up in theme number 6, right? What are we going to be talking about next?
Well, in theme number 6, we get into a little bit more about the sources of data and how data can be used and transported using Internet of Things technology, IoT technology, and how that could become an important technology, an enabler for a lot of things that we talked about here.
Sounds great. Look forward to that. Thank you very much. Again, that's Dr. Matthew Leotine. He's vice president at BLR Research, where he's a sought-after management consultant, and he's also a professor at the University of Illinois at Chicago. And Matt, we will talk again.
Thanks, Gene.